The global supplement industry makes $180 billion a year selling vitamins to seniors, many of which are not only useless after 60, but are actively damaging your heart and kidneys. I am Dr. Elliot Grant, cardiac surgeon. Today I am giving you the exact list I give my own patients for vitamins to throw away immediately, and for that could genuinely add years to your life. Let me start with a number that should make you angry: $180 billion. That is $180,000 million. That is how much money the global supplement industry makes every single year selling vitamins, minerals, and herbal pills to people like you. To put that number in perspective, that is more than the entire GDP of New Zealand. That is more than the annual budget of the World Health Organization. That is more than what the United States spends on cancer research in a decade. And what do you get for that money? For most seniors, the answer is nothing at best and active harm at worst. Here is the truth that no supplement company will ever tell you, that no colorful advertisement on television will reveal, that no friendly salesperson at the health food store will admit. Vitamins are not harmless, they are not candy, they are not gentle little helpers that can do no wrong. After age 60, your body processes nutrients completely differently than it did when you were 30 or 40 or even 50. Your kidneys filter more slowly, so supplements can build up to toxic levels. Your liver metabolizes drugs and supplements differently, so interactions are more common. Your stomach absorbs less of some things and more of others. Your gut bacteria change. Your hormone levels change. What was safe at 40 can be dangerous at 70, and many popular vitamins that are fine for a 30-year-old can actually increase your risk of heart attack, stroke, kidney stones, lung cancer, and even sudden cardiac death when you take them after 60. I see it in my practice all the time. A senior comes in with fatigue, heart palpitations, abnormal kidney tests, or dangerously high calcium levels. I ask what they are taking, and they pull out a shopping bag full of supplements: vitamin E, vitamin A, calcium pills, iron tablets, herbal blends, energy boosters, heart health formulas, immune support complexes, 12 bottles, 15 bottles, 20 bottles. And when I ask why, they say, "But doctor, they are natural." Let me be very clear. Arsenic is natural, poison ivy is natural, hemlock is natural, a tiger is natural. Natural does not mean safe. Natural does not mean good for you. Natural does not mean tested or proven. The supplement industry is largely unregulated. Companies can put almost anything in a bottle, make almost any claim, and sell it to you without a single clinical trial proving it works or is safe. Today, I am going to give you two lists. First, for vitamins that I tell my own patients to throw away immediately, not be careful with, not take less of, throw away. Second, for vitamins that could genuinely add years to your life, not expensive brands, not fancy proprietary blends, not celebrity endorsements, just the ones that have real, peer-reviewed, replicated science behind them for people over 60. Let me start with the dangerous four. The fourth most dangerous vitamin for seniors is vitamin E. You will find it in countless antioxidant blends, heart health formulas, brain support pills, and anti-aging capsules. It is often listed as DL-alpha tocopherol, mixed tocopherols, or simply vitamin E. Here is why. It is dangerous. Vitamin E is what we call a natural blood thinner. It slows down your body's ability to form clots. Now, that might sound good on the surface. You do not want dangerous clots causing a heart attack or stroke, but here is the problem. When you take high doses of vitamin E, especially if you are already on prescription, blood thinners like warfarin or apixaban, or even over-the-counter blood thinners like aspirin, you can tip over from safe thinning to dangerous bleeding. I have seen seniors come into the hospital with nosebleeds that lasted for hours. I have seen them with blood in their urine that turned their toilet water pink. I have seen them with bleeding in their stomach that caused black tarry stools, and the worst cases bleeding into their brain, that is a hemorrhagic stroke. One large high-quality study of over 35,000 people found that taking vitamin E increased the risk of hemorrhagic stroke by 22%. 22%, that is not a small number. But here is the real kicker. Not only is vitamin E potentially dangerous, but multiple large studies have also shown that high-dose vitamin E does absolutely nothing to prevent heart disease. It does not lower your risk of heart attack. It does not lower your risk of ischemic stroke. It does not help your memory or prevent dementia. It does not reduce inflammation in any meaningful way. It does nothing beneficial. So you are taking a pill that increases your risk of bleeding and does nothing good for your heart or brain. That is a terrible trade. Throw it away. If you want antioxidants, eat a handful of almonds or sunflower seeds. That gives you natural vitamin E in safe, food-based amounts without the risk of overdose. The third most dangerous vitamin for seniors is vitamin A. You will also see it listed as beta-carotene, retinol, retinol palmitate, or retinol acetate. It is found in many standard multivitamins, skin health formulas, eye supplements, and immune support blends. Here is the danger: vitamin A is fat-soluble. That means your body does not pee out the excess like it does with vitamin C or B vitamins. Instead, your body stores vitamin A in your liver. Over months and years, that stored vitamin A builds up, and when it builds up too much, it becomes toxic. Vitamin A toxicity causes liver damage, joint pain, bone pain, hair loss, dry skin, cracked lips, and even calcification of your heart valves. That is when your heart valves become stiff and stop closing properly, leading to heart failure. But here is the part that most doctors do not warn seniors about. For older adults, the risk of vitamin A toxicity is much higher because your liver works more slowly. A dose that was perfectly safe at 40 can be dangerously high at 70. Several very large studies have linked high vitamin A intake to an increased risk of hip fractures. The famous Women's Health Initiative, which followed tens of thousands of women for over a decade, found that women who took vitamin A supplements had a 40% higher risk of hip fracture compared to those who did not. 40%. Let me say that again. 40% higher risk of breaking your hip, and we know that a hip fracture in a senior is a devastating injury. 1 in 4 seniors who break a hip die within a year. Many more never walk independently again. And what do you get for that risk? Nothing, because you can get all the vitamin A you need from food: 1 medium sweet potato, a handful of carrots, a cup of spinach, a few slices of cantaloupe. That is plenty. You do not need a pill. If you have a multivitamin on your shelf right now, flip it over, look for vitamin A or beta-carotene. If it has more than 2,000 international units, throw it away. Do not finish the bottle. Do not use it up. Throw it away. The second most dangerous supplement for seniors is calcium supplements, and I want to be very specific here. I am not talking about calcium from food: cheese, yogurt, milk, canned salmon with bones, sardines, tofu, leafy greens. Those are all safe and healthy. I am talking about calcium in a pill: calcium carbonate, calcium citrate, the tablets you buy at the drugstore. You see commercials telling seniors to take calcium for their bones. Osteoporosis is real. Broken hips are real. I understand why you want to protect your bones, but here is what those commercials do. Not tell you, calcium supplements do not go directly to your bones. They go into your bloodstream first, and when you take a large dose of calcium in a pill, your blood calcium levels spike rapidly. That spike can cause your blood vessels to calcify, to become hard like bone. Calcified arteries are stiff arteries. Stiff arteries mean high blood pressure. High blood pressure means heart attacks and strokes. A major analysis that combined the results of multiple studies found that calcium supplements increase the risk of heart attack by about 30%. 30%, that is enormous, but that is not all. Calcium supplements also dramatically increase your risk of kidney stones. Your kidneys have to filter all that extra calcium out of your blood. When there is too much calcium, it can crystallize into stones. I have seen senior patients pass kidney stones the size of small pebbles. It is excruciating. Some of the worst pain I have ever witnessed, and many of those patients end up in the hospital, dehydrated, in agony, sometimes needing surgery. But here is the good news. Calcium from food does not cause these problems. Your body absorbs food calcium slowly over hours, along with other nutrients that help it go to your bones instead of your arteries. You can get all the calcium you need from 3 servings of dairy or calcium-rich foods per day: a cup of yogurt, a glass of milk, a slice of cheese, some canned salmon, a bowl of fortified oatmeal. That is enough. Throw away your calcium pills if your doctor insists you need them because you cannot eat dairy or you have a proven malabsorption problem. Ask for a very low dose, no more than 500 milligrams per day, and take it with food to slow absorption. But for the vast majority of seniors, food is safer, better, and cheaper. And now the number 1 most dangerous supplement for seniors: iron. Iron supplements are sold for energy, for anemia, for blood building, for vitality, and for women's health. You will find iron in many standard multivitamins, especially those marketed to women. Here is the truth that could save your life: after age 60, and especially after age 54, women who have gone through menopause, your body does not lose iron as easily as it did when you were younger. When you were menstruating, you lost blood and therefore iron every month. When you were growing, your body used iron to build new tissue. But after menopause and after you stop growing, your body holds on to iron. You are not losing it the way you used to. So iron builds up, and excess iron is toxic. Iron acts as a pro-oxidant. That is the opposite of an antioxidant. Instead of protecting your cells, it creates free radicals and stable molecules that damage your heart muscle, your blood vessels, your liver, and your brain. Excess iron has been linked to heart failure, to arrhythmias like atrial fibrillation, to liver cirrhosis, to diabetes, and even to Parkinson's disease and Alzheimer's disease. One large study from Finland followed almost 2,000 men for over a decade. It found that those with higher iron stores had a significantly higher risk of heart attack and stroke. Another study found that seniors with high iron levels had brain scans showing more damage. Here is the bottom line. The only seniors who need iron supplements are those with documented iron deficiency anemia diagnosed by a blood test. And even then, the dose should be low and taken only under a doctor's supervision. Do not take iron just in case. Do not take a multivitamin with iron unless a doctor tells you to. Go to your medicine cabinet right now, pull out your multivitamin, flip it over. If it says iron, switch to a senior formula without iron. Throw away any iron supplement you bought for energy. It is not giving you energy. It is damaging your heart. I have seen patients stop iron supplements and within weeks their fatigue improved, their heart palpitations stopped, their joint pain lessened. Less iron was more energy. Do not make the mistake of thinking more is better. So let me pause here for a moment. I have just told you to throw away vitamin E, vitamin A, calcium supplements, and iron supplements. You might be feeling a little overwhelmed. You might be thinking, Dr. Grant, my doctor told me to take calcium. My friend swears by vitamin E. I have been taking iron for years. What am I supposed to believe? I understand the supplement industry spends billions of dollars every year convincing you that more is better, that natural is safe, that you need dozens of pills to be healthy. But after age 60, less is very often more. Your kidneys and liver cannot process a dozen different pills the way they could at 30. Every pill you add is another thing your body has to filter, another potential interaction with your medications, another chance for something to go wrong. Most of what you need, you should get from food. A plate of salmon, spinach, sweet potato, and yogurt gives you more nutrition than 20 pills. That said, there are 4 supplements that have real, proven, replicated benefits for seniors. These are the ones I recommend to my own patients. These are the ones I give to my own parents. They are inexpensive. They are widely available at any drugstore or grocery store. They have good science behind them. And for most seniors, the benefits far outweigh the risks. Let me give you the essential 4. The 4th essential supplement for seniors is vitamin B12. Let me explain why this one is so important. As you age, your stomach produces less stomach acid. That is a normal part of aging. But stomach acid is needed to separate vitamin B12 from the protein in food. So even if you eat plenty of meat, fish, eggs, and dairy, all good sources of B12, you may not be absorbing it. Studies show that anywhere from 10 to 20% of seniors have low B12 levels and do not know it. Some studies put the number even higher, especially in seniors over 75. Low B12 causes a long list of problems that are often mistaken for normal aging. Fatigue that does not get better with rest, brain fog and trouble finding words, memory problems that look like early dementia, numbness and tingling in your hands and feet, balance problems and unsteadiness when walking, depression and mood changes. I have seen patients who were told they had mild cognitive impairment and within weeks of starting B12, their thinking cleared up. I have seen patients who were falling frequently, and after B12, their balance returned. It is that powerful. But here is the trick that most doctors do not tell you. Most multivitamins use cyanocobalamin, a cheap synthetic form of B12 that is fine for younger people, but for seniors with low stomach acid or absorption problems, you need methylcobalamin or a sublingual tablet that dissolves under your tongue. When you put B12 under your tongue, it enters your bloodstream directly through the mucous membranes, bypassing your stomach completely. Look for a sublingual B12 with at least 1,000 micrograms. Take it under your tongue once per day for 30 to 60 seconds until it dissolves, or ask your doctor for a B12 shot once per month. Do not rely on a standard multivitamin for B12. The dose is too low, the form is often poorly absorbed, and you need a targeted approach. The 3rd essential supplement for seniors is vitamin D. You have probably heard of vitamin D for bones. It helps your body absorb calcium, but vitamin D does so much more. It supports your immune system, helping you fight off colds, flu, and even pneumonia. It reduces chronic inflammation throughout your body, which is a root cause of heart disease. It helps prevent falls by improving muscle strength and coordination, and studies have linked adequate vitamin D levels to lower rates of heart disease, diabetes, multiple sclerosis, and even some cancers. Here is the problem: you cannot get enough vitamin D from food. Fatty fish like salmon and mackerel contain some, egg yolks contain a little, mushrooms contain a little, but not nearly enough. Your skin makes vitamin D from sunlight, but after age 60, your skin becomes less efficient at this process. Plus, many seniors spend more time indoors, and even when you go outside, sunscreen blocks vitamin D production. The result is that vitamin D deficiency is extremely common. In seniors, I test my patients regularly, and more than half have low levels. Some have extremely low levels. So how much should you take? Most experts recommend between 1,000 and 2,000 international units per day for seniors. Do not take more than 4,000 without a blood test, because too much vitamin D can cause kidney problems and dangerously high calcium levels. Look for vitamin D3, not D2. D3 is the form your body makes from sunlight, and it works better. You can buy it cheaply at any drugstore. Take it with food that contains fat. Breakfast with eggs, yogurt, or peanut butter is perfect because vitamin D is fat-soluble and needs fat to absorb. If you live in a northern climate, if you do not go outside much, if you wear sunscreen, if you have darker skin, this supplement is non-negotiable. It genuinely adds years to your life. The second essential supplement for seniors is magnesium. This is one of the most underrated minerals for heart health, and most seniors are deficient. Here is what magnesium does. It helps your blood vessels relax, which lowers blood pressure naturally. It helps your heart maintain a normal rhythm, reducing palpitations and arrhythmias. It reduces inflammation throughout your body. It improves sleep quality and helps you fall asleep faster. It relieves muscle cramps, restless legs, and constipation, all common problems in seniors. It even helps regulate blood sugar, and most seniors do not get enough from food. Good food sources of magnesium include leafy greens, nuts, seeds, beans, and whole grains. But even with a good diet, many seniors fall short. Why? Because certain common medications deplete magnesium. Diuretics, also called water pills, flush magnesium out of your body. Acid blockers for heartburn reduce magnesium absorption. Some blood pressure medications and diabetes medications also lower magnesium levels. So how much do you need? Around 300 to 400 milligrams per day, but form matters enormously. Magnesium oxide is the cheapest and most common form. It is poorly absorbed, and what is not absorbed gives you diarrhea. Magnesium citrate is better absorbed but can still cause loose stools. Magnesium glycinate is the best form for seniors. It is highly absorbed, gentle on your stomach, and the glycine part helps with sleep and anxiety. Start with 200 milligrams at bedtime. If your digestion handles it well, increase to 400 milligrams. Do not take magnesium if you have severe kidney disease without talking to your doctor. For everyone else, this supplement is a game changer for sleep, cramps, blood pressure, and heart rhythm. And now the number one essential supplement for seniors, omega-3 fatty acids, usually from fish oil. I recommend this to almost every senior patient I see, unless they have a specific contraindication. Here is why. Omega-3s are powerful anti-inflammatory fats. Inflammation is the root cause of heart disease, arthritis, dementia, and many other age-related conditions. By reducing inflammation, omega-3s help protect your heart, your brain, and your joints. They also thin your blood slightly, not as much as aspirin or prescription blood thinners, but enough to reduce the risk of dangerous clots. They lower triglycerides, which are a type of fat in your blood that increases heart attack risk. They improve your HDL, the good cholesterol. They reduce blood pressure slightly but meaningfully, and multiple large studies have shown that seniors who take omega-3s have lower rates of heart attack, stroke, and sudden cardiac death. The GISI Prevention trial, one of the largest heart studies ever done, found that heart attack survivors who took omega-3s had a 20% lower risk of death. 20%, that is enormous, but not all fish oil is created equal. You need a brand that has been tested for heavy metals like mercury and for oxidation, because rancid fish oil is worse than useless. Look for a product with at least 1,000 milligrams of combined EPA and DHA. Those are the active ingredients. Read the label carefully. Some products say fish oil 1,000 milligrams but only contain 300 mg of EPA and DHA. You want at least 1,000 total. Take it with food. To reduce fishy burps. If you cannot tolerate fish oil, consider algae-based omega-3s, which are plant-derived and have the same benefits without the fish taste. If you take prescription blood thinners like warfarin or apixaban, talk to your doctor before starting omega-3s because the combination can increase bleeding risk. But for most seniors, this is the single most beneficial supplement you can take. You have just heard the two lists. For to throw away immediately: vitamin E, vitamin A, calcium supplements, and iron supplements. For to consider after talking with your doctor: vitamin B12, vitamin D, magnesium, and omega-3s. But here is the most important thing I can tell you. Supplements are called supplements for a reason. They supplement a healthy diet. They do not replace real food. No pill can match the benefits of leafy greens, berries, nuts, seeds, fish, yogurt, and beans. Before you buy any supplement, ask yourself 3 questions. Do I have a diagnosed deficiency based on a blood test? Is there good, replicated science for this specific supplement in people over 60? Am I taking this instead of eating real food? If the answer to that last question is yes, save your money and spend it on groceries. Now I need you to take action. First, go to your medicine cabinet right now, or as soon as this video ends, pull out every vitamin and supplement. Check the labels for vitamin E, vitamin A, calcium, and iron. If you see them, throw them away. Do not give them to a friend. Do not save them just in case. Throw them away. Second, if you are not already taking them, talk to your doctor about getting your B12, vitamin D, and magnesium levels tested. Bring this list to your next appointment. Third, click the like button right now so this video reaches another senior who is wasting money on dangerous supplements and putting their heart at risk. Subscribe and turn on the notification bell. I post a new senior health video every single week. Next week, I am revealing the #1 morning drink that seniors should never consume on an empty stomach. It is in almost every home. You do not want to miss it. Share this video with your spouse, your parents, your siblings, and anyone you know who has a cabinet full of vitamins. You could save them from a bleeding stroke, a kidney stone, a hip fracture, or a heart attack. This is Dr. Elliot Grant, cardiac surgeon with 25 years in the operating room, reminding you that more is not always better. Sometimes the best supplement is an empty hand. Stay smart, stay safe, and I will see you in the next video.